Welcome to Team Gut Girls, the podcast for anyone who's ever unbuttoned their jeans at 10 a.m., mapped out every public washroom in a 10-kilometer radius, or wondered why one bite of food can ruin an entire day. We talk about bloating, constipation, diarrhea, reflux, nausea, abdominal pain, histamine chaos, and all the quiet gut symptoms you're told to just live with. Join naturopathic doctors Dr. Whitney Baxter, Dr. Christina, and Dr. Dominique Vanier. Your gut is talking, and we're here to help you translate. You're with Team Gut Girls now. Let's dig in.
And before we dive in, just a quick note. This podcast is for educational and informational purposes only. It's not meant for medical advice and doesn't replace working with your own healthcare provider. We're sharing general information, not diagnosing or treating anyone. Please always talk with your physician or licensed healthcare practitioner prior to making changes to your health, medications, or supplements.
Hello, everyone. This is Dr. Whitney, and I'm joined by Dr. Dominique and Christina, little babies. I hear some yapping. But we want to talk about when bloating is normal. So this whole series is on bloating when other things are going on, but bloating is one of those things that could be such a range of things, right? So it could be just your normal digestive process. You've had a large meal, got to go somewhere, or it could be something else going on. So something in the gut or hormones or immune system. We talk about MCAS or mast cell activation syndrome in another podcast. So it's really, I think, important to kind of understand our digestive process, of course, but then like be in tune with when we're unsure of like how to ask our doctor or bring it up. So I had a patient ask me a question, and I did get her permission to share this story, but she said, I've been doing all the things that we've talked about. I'm feeling so much better. But every time I eat a lot of beans or I'm eating too fast, I'm noticing I'm still getting bloated. And she said, but is that normal? And she could like self-reflect as she was talking about it. And I wanted to clap and say, yes, that's normal. That's great. Because we hear a lot on social media, and I'm sure patients ask you guys too, and friends and family ask me this all the time. Like they get like really concerned about things that like we shouldn't just have a flat, perfect digestive tract all the time. Do you guys get patients who ask you these things too, or?
Yeah, I often will tell people like on a cadaver, when you open up the intestines, like they're really flat. Like, so people can just like kind of understand like, oh, there's times when there's flat and there's times when there's things in them, and whether that's substance or air, but like to think about, oh, like it's not like a heart, right? Or a liver where it's like always this like one kind of structure. And so sometimes even just thinking about, oh, like it actually does change shape is actually really important to people.
Yeah. I've had many conversations where like there's a difference between, I'll call it pathological bloating and normal bloating. And when it comes to normal, is that it's often related to what somebody eats, although so is pathological. It can be anyway, but and there's like a typical kind of daily presentation, which is a little bit flatter in the morning, possibly flatter like after a bowel movement, and then we can progressively see a bit of expansion happen throughout the day, just based on just like a space occupying effect of eating food, just like what Dr. Christina just said.
Yeah. So let's talk about kind of going on. Like Christina said, it is a tube all the way down with a whole bunch of different systems and mechanisms going on to get that food that we're eating mashed up really small so we can absorb it. And then around this tube, there's all this muscle that has to churn it and move it down and out. So it's quite the process. So yeah, if you're eating like little bits slowly, 3 meals a day, and lots of time in between to let it digest, then you might not notice much. And we shouldn't really notice much, but it makes sense if you ate like a protein-rich meal that takes a bit longer to be digested, or at Christmas, everyone's lying down after dinner. You brought your sweatpants to your family's house. Like it's to be expected.
It's like one of the reasons why like so many European cultures, right, which maybe don't have as much climate that they have to deal with. Like they always walk after dinner, right? To get like the muscle moving, to get the tube moving, to like get things passing through the system. And so I would say like that's one of the things that maybe we don't do as much in North America, and that could really help with that sensation. It's just like getting all that muscle moving.
Yeah, exactly. Okay,
We have a few honorary members on this podcast today, like we are talking about before. We have one of Whitney's babies, my baby.
Our goddess hold their second brain, so there's so many nerve endings around it that's like communicating with our brain to make sure everything's safe and going well, and hunger, fullness cues. So we need to really be in that rest and digest mode, so the whole thing can get the signals it needs, as opposed to, no, I need to think about something else. I need to run away from a bear, because our brain can't decipher between a bad email versus this like heightened fear, depending on how you perceive it. So if your body thinks it's needing to run or work on something else, that blood flow in that system isn't going to be as optimal. So might lead to some bloating if you're rushed eating or you're really stressed all the time. So not necessarily problematic, although it may be if it's just not working every day, but not just not optimal.
Have you ever looked, Whitney, into the timing, like how long things should be in which part of the tube?
Yeah. So the transit time, right, Evelyn? It's great, right? Like anywhere from like, is it like 24 hours to 72 hours I've seen?
Well, even like if we think about like how soon after you eat could you start getting bloated? It might be like from an hour, right? So kind of half an hour into the stomach, about on average 27 minutes in the stomach, unless you're taking Ozempic or one of the tirzepatides. And then like, maybe an hour after might be when people start to first have that bloating. So a bloating that happens before then is probably a different situation. Like that might be one of our differentiators for people.
Yeah.
Like such as bloating with water, or bloating with one bite, or bloating with any food. Those would all be in the abnormal category based on the timing of under which it happens. Yeah.
Yeah, good point.
And what kinds of things are in the tube, Whit?
In this tube? Well, we've got a nice big compartment called our stomach, and it's going to churn everything up. It's where our proteins are broken down, and it's then signals, okay, there's a volume change, so that needs to happen. So sometimes people get like really bloated up top if something isn't effectively happening there. And then that's signaling more digestive enzymes to hit this bolus of food once it hits the small intestine. So that's where more of our fats and our carbohydrates get broken down, and a little proteins a little bit more. And then that's where everything's getting absorbed as well. And then once it hits the largest part of the tube, the colon, our microbiome, our friendly ecosystem of microbes. Oh boy.
That's all right. This is real life. We have lots of listeners who have children on this podcast.
Yeah. This one's sick today, so we're just having some fuzzers. Yeah, so it's normal for, like, we want some bloating, we want some gas production, because this is really important for our body. So that microbiome is fermenting fibers that we can't digest. It's creating gas in the process of them digesting it, called short-chain fatty acids. And we need those for lots of good things, like an anti-inflammatory effect, good mood. What other things are short-chain fatty acids good for?
So to recap, we've got normal levels of bloating and subnormal levels of gas that can happen.
Okay. Yes. Yeah, and we don't necessarily always feel this we shouldn't feel everything that's going on in our gut, like the movement, the stretching, the gas that's happening. And sometimes we do, and that's totally normal. But it should be predictable. It shouldn't be lasting all day. It shouldn't happen as soon as you look at your meal or you start to eat. Yeah.
And can normal bloating have a distension in the stomach? Or is it just a sensation?
I would think it could be a little bit of both, but essentially it's a good, like if you're eating a large meal and you eat it really fast, there could be some distension, but sometimes it could be one or both things that could mean something else is going on. So bloating can just be a sensation where you're not getting that expansion or swelling of your abdomen, not having to unzip your jeans, versus you are getting that expansion, and that's called distension. So we'll talk about some mechanisms of how that can be going on. Yeah. Anything else to add with like normal bloating?
I want to emphasize the short chain fatty acid part. So like the fermentation of certain foods by we'll call it more beneficial bacteria that happens in the large intestine. Like this short chain fatty acid is, we'll call it, I mean, I would say it's a marker of health as well, right? Because it has so many different positive benefits to the host, right? Like decreasing risk of certain diseases, decreasing inflammation, supporting mucosal lining, et cetera, et cetera. So we do need gas, like we said, but it's like, there's also like kind of a turning point of when gas is not normal. And so when I'm having conversations with patients, the certain things that I'm asking are like, does it feel frequent? Is it associated with distension, which is an increase in girth? Is there pain? Is it like always odorous? Like some of these interesting points, right, which can help differentiate a abnormal versus normal amount of gas.
And gas can be higher up too, right? It could be burping.
Yeah.
And these are normal mechanisms the body has to get rid of gas that we swallow. So there's like things going on that's normal. The way gas gets into that tube. So we could be like having carbonated beverages. So that's some gas going into the system. We could be eating really quickly, talking while we're eating, drinking large gulps of water. Some people didn't even notice that they're doing it. But our body has mechanisms to rid of this introduced gas. So burping is one of them. Passing gas is another. And then we've got the microbiome fermentation. So again, like Dominique just talked about, that's normal in the colon. There should be some gas being produced there. And again, we have ways of getting rid of it. So other species can consume that gas for their nutrition. We reabsorb back into our bloodstream, or it can be passed as gas. And then that gas also needs to be pushed through. So our gut has normal motion, normal motility. And then, like I just talked about, the absorption. So there are ways that our gut should be functioning to get rid of this. So a little bit of burping, non-odorous, passing of gas is good. Something is going on in your gut that we want. Mm-hmm. Other normal processes, so our hormones. So during our menstrual cycle, about 2 weeks prior to getting your period is you're ovulating, and then your progesterone starts to spike, and our progesterone really slows everything down. So all the way from slowing our stomach emptying and slowing down the whole gut motions. A little bit of bloating before your period is kind of normal. Maybe you might get a little bit of constipation, but we can really work with this just more walking, heat. So if it's not impacting your day or not causing a lot of pain, then kind of depends on your situation, but we're not too concerned. Yeah. Anything to add about other normal processes or how the body manages the gas?
As the endometrial lining thickens towards a person's period, the size of the uterus may also change too, right? So like when we talk about bloating, especially that lower abdominal bloat, which again, a bloating and distension are two different things. Like when we see the stomach start to protrude, or the lower part of the abdomen protrude, it may be because like the size of the uterus is increased a little bit too. And then we'll see like, cycle day 2, cycle day 3. that go down a little bit too, because we've lost, well, at least most menstruators have lost the majority of their blood for that period by that time.
So lots of reasons for normal bloating.
Yep.
Yeah.
But not everyone's bloating is normal.
Not everyone's
Like-
normal.
So what are the top things that we want people to know about when their bloating might not be normal?
So I think we talked about this, a lot of pain that's happening like as soon as you start eating, or if you're finding everything's causing bloating. You had food triggers you thought in the past and it was pretty traceable, but now it's not, or even with water. If it's associated with changes in stool patterns, so all of a sudden you're getting a lot of diarrhea, looser stools, or you're not having a bowel movement regularly every couple of days. Actually, one of the most common things that bloating is caused by is constipation. And so we want to rule that out. And not everyone's tracking, not everyone's taking a peek. And also you could still be having like bowel movements, but they're not fully complete. So the gas is getting trapped somewhere. There's like the motility of that tube and the muscle isn't functioning optimally. So there's some trapped gas.
And I would say to age, right? Like if this is happening all of a sudden to a person in their 20s versus somebody in their 50s or 60s who's had normal digestive patterns their whole life and all of a sudden they're getting bloated, those are two different clinical scenarios that will be looked at differently, where the latter is a little bit more risky, right? Like we want to look at, discuss like last colonoscopy or fit test, or certainly like evaluate whether there's bright red blood or dark tarry stools happening, right? Because, we want to make sure that we're looking at whether this is early colon cancer, which is not to say that colon cancer is not happening in young people, which may be a separate episode because that has increased significantly also over the last decade.
I would also say like recent history. So if you take antibiotics, if you got a virus, if you had a food poisoning, and those are all reasons that bloating might be happening that are correctable because they are more abnormal, but sometimes people think it's just part of their recovery process, or they were told that it was normal.
Yeah. And that's why we always recommend to people to track it. Get on your period apps and include your digestion. If you're unsure about your gut health, or you saw something on social media, or you're talking to a family member, just start to track it and you might see a pattern. You're like, oh, okay, that happens every time I eat this, or I can't find a pattern, I'm kind of concerned. And then of course, pain, red blood, the dark tarry stools, that could mean that blood is happening higher up along that tube. So by the time it gets down and out, it's just darkened.
If you added things like iron into your diet, it can also cause some black stool. So keep in mind, there's other reasons why it could be darker.
Pepto-Bismol can also do that. So some things that people can kind of start to think about now. So some bloating after meals is totally normal. It's okay to pass gas, and you can start to track, especially if it's happening after large or rushed meals, or you are like, hey, I am eating my lunch during work. Like I'm really rushing all of my meals. If you start to eat slowly, sitting down. I mean, obviously, I'm holding a baby right now. That's not always possible, but just be more mindful of it. There's research to show that up to 40 chews is the most effective, but just do what you can. Start to notice if you're really rushing the meal versus like chewing effectively to start that digestive process in the mouth. And then things like avoiding carbonated beverages, or if you're chewing lots of gum, sucking on lots of hard candies, or introducing gas into the system just from your mouth. And then other things we talked about, like gentle movement after meals, maybe if it's pouring rain or if it's freezing cold. Then you want to just do some like stretching, yoga for digestion on YouTube. There's a lot of good things that pop up if you can't get out for a light walk after a meal. And then deep breathing, there's tons of research on it. But
And if you've tried everything and nothing is working, then definitely seek out someone to talk about your bloating.
Yeah. Yep. Oh, always getting a few extra blood tests done and possibly an abdominal ultrasound, right? Abdominal pelvic ultrasound could be indicated, but always important to discuss this with a healthcare provider because it could be normal and it could not be.
Yep. Exactly. And if all your tests come back normal and you're still feeling it, there's another thing we'll talk about in a different podcast called visceral hypersensitivity, or happens a lot in irritable bowel syndrome, but that can be frustrating. Another.
Super helpful. Thank you, Whit, for putting this episode together.
Thanks, guys. That was fun. Thanks, babies, for hanging in.
Thank you for joining Team Gut Girls. Like, follow, subscribe, and share a podcast with friends you think will want to know more about their gut. You can also visit us at teamgutgirls.com for show transcripts and more information, because better gut health changes everything. See you next time.